talking about drowning today. We're talking about submersion injuries. I guess that can happen in a number of different places, whether that's inside the house, outside the house, more rurally.
Yep.
What have you seen? Like, where does this happen?
Backyard pools, like you said, bathtubs down at the lake. So a lot of people have backyard pools, so the safety features are important. But people going to the cottage, they go down to the lake. We see them there as well. It's people maybe not comfortable with the water that they're in. So there could be a current, there could be undertows, things like that. And water temperature is still a bit of an issue this time of year.
Okay. Well, looking at our backyard here, this is lovely landscaping. And we see we've got a pool that looks very inviting. But let's talk a little bit about just looking here, what's safe and what's not so safe in this environment.
Well, you can see that there's a fence around the backyard. It's gated. You want to be careful if your pool or your deck is attached to the house directly, that you have a safety mechanism there that children can't accidentally get out.
Okay. Yeah, I always worry about that when the house itself is acting as one of the barriers of entry into the pool. Because it's not that hard for a little toddler or 2-year-old. I know my 2-year-old, he can pretty much open every door on the planet. He can probably, open any door with any lock at this point. And so I worry about him because he can just walk up and unlock a door and he's out the front door going wherever he wants. And so, if there's no pool safety fence, I guess, around that, he just needs to open the door and he's in the pool. Yeah.
So there is doors that you can purchase that have locks that are right up above the top so that children can't access those. And it's always good to have two or a backup locking mechanism, especially in summertime when children are getting in and out of the house and playing around the backyard.
Yeah. Well, he's not that tall yet. He's only 2.5, but I think in another 10 minutes he'll be about as tall as I am.
There you go.
All right. Well, so looking here now, I guess the other issue is there anything specific to lake safety? We're around a pool and there's some issues there. Is there any issues that are specific to lake safety?
So they're often quite busy in the summertime. You get people that are out on various, personal watercraft that are out there on paddle boards, canoes, kayaks, things like that. And it's easy if you get a little bit of a current or waves that people cannot be seen. They can go under quickly. Like I said, if you get that undertow or you get a bit of a rip, it's not Mexico, but those things still do exist here. So it's important that you're watching children there. PFDs and life jackets, you want to make sure that you're getting a properly fitted life jacket. So PFDs are personal flotation devices, whereas a life jacket is designed to roll you over if you're injured or unconscious and keep your head above the water so you're not breathing that water in.
Now, can those be used as substitution for supervision? Like I put my child in a PFD and throw him in the water and I can go and mow the lawn?
No, because there's actually been some recent incidents where I think it was in Georgia where a girl had a bit of a floaty ring on. She jumped in the pool, and because it wasn't designed to keep her upright, she actually flipped face down, and her sister had to rescue her. So those aren't, and most of them say it, but you want to make sure that you're getting something that's approved if it's going to be a life jacket, and stay away from some of those things where kids can be flipped upside down or that sort of thing. And like you said, it's not a be-all, end-all. You still need that supervision. You still need to make sure that somebody's watching them at all times.
So what we're really talking about then is prevention. We're talking about making sure this never happens. And we often in the medical community will talk about primary prevention. We want to make sure this doesn't happen ever. So a never event. We don't want your child ever to have to be pulled out because they've had a drowning event. So keeping the environment safe, making sure we've got sober eyes on all the time. These are the kind of things that we're talking about with primary prevention. Is that kind of what the message we're sending?
Yeah, and kids they're carefree, they're not careless. So we have to be the ones that are being careful and watching and making sure that they're safe. And if something's not safe, then correcting that behavior.
Excellent. All right. Well, so now I guess if we transition, so what happens now if something does happen on scene?
So this is our pool scene. This is a mannequin. So what you want to do is make sure that you're in a safe place. So away from the pool as much as you can, and dry the patient off. And CPR is always most cardiac arrests happen outside of or in the house, and they're not out in the community. So especially if you have a backyard pool or a cottage or something like that where 911 response could be delayed, you want to make sure that you know CPR, even if it's hands-only CPR. Again, this is not a CPR course or anything like that.
People shouldn't use this video as they're not going to get a certificate from this video.
They are not.
Okay. So there's a number of ways I guess parents can get CPR training in the community and they can kind of do that.
Yep.
I sort of see it, CPR is like insurance. You don't buy insurance because you're expecting something to happen. You buy insurance because something might happen.
Yeah.
You can't buy insurance after. If my house burns down, I can't get fire insurance
Yeah.
and get them to pay up. And so really, I guess we want CPR training for parents before anything happens, so they've got that skill set.
Yeah, and it can come back to water safety, drowning, things like that. But, backyard pool, eating hot dogs, hamburgers, things like that, you want to make sure that you're able to help your child or somebody else's child for that sake.
Okay.
If something was to happen.
Now I see in this case, we've pulled this mannequin out, but we've pulled this child out and we put him here. Should I, if this were to happen and this is my child in a pool, should I take him and run inside the house and run upstairs to the bedroom, or should I start my resuscitation right at the pool side here?
Well, we talked about prevention and picking up the child and running. You could potentially injure them further. You could potentially injure yourself. So as long as you're in a safe place, away from any sort of electrical things like that, then that's adequate. And then you want to seconds count here, like we said. So you want to start CPR and call 911 immediately. If you're by yourself, then maybe you want to take the child to the phone so you can call 911. But yeah, so simple hands-only CPR. You're going between the nipples. And you mentioned rate, so you want to make sure you're going at least 100 compressions a minute, so between 100 and 120.
And we know with kids their hearts are very, very sensitive to having low levels of oxygen. And we know that if a child becomes hypoxic, which is when the oxygen level in the body goes down, it's just seconds before that heart starts to slow down and then stop. And we know that kids that have heart attacks and their heart stops, the primary reason for their heart stopping is that they become hypoxic or low oxygen. So it's not going to take long in the pool for that to go from the kid is face down to now their heart is stopped. And so you're starting compressions to get that heart going again. Is that right?
Yeah, and it can take as little as 10 seconds and 5 centimeters of water for a child.
10 seconds, 5 centimeters of water.
Yep.
So that's not that much time at all.
No.
And if I think about some of the other organs that we see that we know are very, very sensitive to low levels of oxygen, we know that the heart, especially in kids, seconds count, but also the brain. And the brain is very, very sensitive. You've got a developing brain. It needs oxygen. It's, children's brains and everybody's brains, but children specifically are like a Formula One race car. You can't run it without gas, and that gas is going to be the oxygen. And so, as soon as that oxygen supply stops, we may start to see already, concerns around brain damage and long-term tragic consequences, whether that's death or whether that's disability.
Yeah. So once you're doing your CPR, you're going to keep doing your CPR until either it's not safe to do so, or somebody else can take over. Hopefully, we're not too far away, and our first responders can arrive and take over care from us.
So our first responders arrive on scene. Can you walk me through what's going on here, Dave?
So they're just doing a quick pulse check just to make sure that there's no pulse there. Did a quick breathing check, and they're doing 2-person CPR here, so one person's doing compressions. And they're going to start oxygenating the child with a bag valve mask and attach our defibrillator.
Okay. So this hopefully starts to reverse that course. I mean, we talked about primary prevention, which is making sure this never happens in the first place. And then sometimes we'll talk about secondary prevention, which is now there's been an event. How do we minimize the tragedy from that event? And so getting them out quickly, getting them somewhere flat and safe, starting CPR, getting 911 called. And then you can see as the first responders arrive, they're getting that oxygen and good oxygen delivery.
Exactly. So yeah, we'll perform advanced airway maneuvers, initiate intravenous lines, and we'll perform ACLS or advanced cardiac life support. We'll let you guys at the hospital know that we're coming in, and we'll transfer care to you guys when we get there.
Absolutely, yeah. We like that call ahead because then we can get the room ready. And these children, and unfortunately we see this every year. Getting that call ahead, we get our resuscitation room ready, which means having the team around. We have our respiratory therapists, our physicians, our nurses, social work, child life. We've got the whole team waiting for you when you show up with that child. And the truth of this is that some of these kids can do okay with the resuscitation, and we try our best because we want that outcome to be good. But there's a real tragedy here that sometimes things don't go well, and I've had that experience in my 15 years of doing this job, that sometimes despite all our best efforts, we can't save that child's life. And then that's something that family has to live with, for the rest of their life. And so what we're talking about today is really having fun, cooling down. It's a hot day. You and I are both sweating here. And, I'm half inclined to jump in the pool, but really doing that in a way that's safe.
Yeah, exactly. Like you said, prevention. If we can prevent it, then we don't have to worry about all the other stuff. It's nice to get out and help people, but I'd rather not respond to these calls and see children or anybody for that matter in a situation like this.
Yeah, it'd almost be better if we didn't need to have a job.
Yes,
if
exactly.
I became unemployed because there was nobody having injuries and emergencies, that'd actually be not a terrible day. That'd be a good day.
We'd go for a swim.
We would just be sitting sitting having a glass of water and drinking and hanging out in the pool. So, some of the messages then, it sounds like, just primary prevention. Make sure we've got, a safe environment for that pool. Sounds like, make sure that there's sober eyes on. You mentioned like that there's always somebody dedicated.
Yep.
That, we can use things like personal flotation devices, but that doesn't substitute sober eyes on. And that it's seconds. So, if you and I are having a conversation and my 2-year-old's in the pool and I've got my back to them.
Yep.
Seconds
to check your cell phone, to send a text message, to check Facebook, anything like that.
So texting driving, bad idea. Texting parenting.
Yes.
Bad idea.
Yes.
Yeah, all right. I can agree with that. Yeah, seconds. Again, that's the message we're trying to get here, is that we want you to have fun, but we need to do this in a way that's safe. And literally it takes seconds from your story to change from a lovely summer day to a tragic event that you're going to live with for the rest of your life. So excellent. In terms of some of the safety measures, anything else that, I know sometimes people have like a pool cover to try and keep kids from going in. I've seen that.
Seen those. There's, I've heard of water alarms. So if that water gets broken with any significant force, then an alarm will go off.
Okay.
Security cameras. Again, we keep saying it over and over again, but prevention, that's what we need to focus on. And
none of those texts, again, those are all great sort of safety measures, but none of that replaces good judgment and supervising that child.
Exactly.
Yeah, okay.
So what about, we've got a question online. What if a child's pulled from the pool and they're not unconscious? Is that still a concern?
Yeah, so it's a good question. So we question about, child's pulled out of a submersion event. Is everything okay? And there's, people may have heard of terms, and they're a bit antiquated. They're a bit old terms now that we don't use that much, but things like dry drowning and secondary drowning really, part of the issue becomes when somebody gets pulled out, they may have aspirated, or water may have gone into their lungs, or they may have had some pressure changes in their lungs because they've been submerged. And so, any child that's having any symptoms, whether that's coughing, gagging, any trouble breathing, we probably need to do a bit of an assessment on that kid.
Yeah, so please give us a call, even if they, like we said, 10 seconds and 5 centimeters. If that child was underwater, we're more than happy to come out and assess, and we'll most likely want to take them in and get them checked out in the hospital and taken care of.
Yeah, most parents at home probably don't have a stethoscope to listen to your chest, don't have oxygen monitoring capabilities, don't have X-ray capabilities. And I know we're lucky at the hospital, even your crew here today has lots of equipment that's very useful for doing a proper assessment on a child that's had a submersion. That's not something that I can eyeball. That's something that we need that equipment to help us decide, is there a risky event that's happened here? Because it's not just about what's happened in the moment, which can be tragic and immediate, 10 seconds, he said, but there also sometimes can be some consequences that happen even minutes later, and we want to make sure we're not missing the opportunity to help that child out. And so, calling you guys is a good idea.
Yes, absolutely.
Okay.
And what if the pool is only shallow, so 3 to 4 feet of water, filled with floaties and things they can grab onto, including the railing? Is that safe?
Coming from my lifeguarding background, not a very good situation to be in. You can easily lose sight of small children, especially if they're playing around, they slip, they fall, get trapped under one of those things. So you want to be able to see them at all times, and if you can't see them, then something needs to be removed from the pool, or they need to be removed from the pool until it's safe for them to go back in and you can see them.
So even like those I've seen those kiddie pools, and we have one at our house, and I'm not sure who likes it more, my dog or my 2-year-old. But you get those kiddie pools, and there's a few, there's like maybe about 6 or so inches or centimeters, 10-ish centimeters, and you were saying like it doesn't take like that amount of water is enough.
Yeah.
Like if my son were to slip and fall and his face down's in the in the pool and he's been knocked his head, he's going to take a couple of breaths of water, and now we're along a trajectory towards tragedy.
Yeah, exactly. Like you mentioned, a slip and a fall, so that can happen. We always hear no running on the deck, but that's there for a reason, and kids can fall, bump their head, and with that small amount of water on your patio, on your deck, on a beach, something like that, they can quite easily still suffer consequences and drowning.
Okay.
Now, what about CPR? You mentioned the importance of CPR training. Should parents only with pools learn that? Is it effective for everyone? And what type of CPR training should be taken?
So I'm a fan of CPR.
Yep.
Like I think CPR for me is like, wow, I can immediately save my child's life. And that may be pool related, and you guys see that, but that could be my child's choking on a piece of food. You mentioned, they're having a barbecue poolside. I think there's a lot of skills taught in a CPR course.
Yeah, and it's there for your kids, but it's there for other people. It's there when you have visitors, things like that, when you're out in the community. I love pulling up on scene, the middle of the road, sidewalk, something like that, and seeing bystander CPR. I get on the loudspeaker and say, don't stop, keep going. So we know that works. We know CPR makes you undead. And so getting out, even if it's just basic first aid, it doesn't have to be a first responder course, anything like that. But just getting out there, there's plenty of places that you can get CPR training, and it works.
Yeah, that's, and we talked about, it's just seconds, for the cascade or, the bad things to start happening, seconds of the brain not getting enough oxygen, seconds for the heart not getting enough oxygen. And if nobody knows CPR, and you guys are quick to respond, but it does take a couple minutes for you guys to get on scene. And if somebody can start that process now and reverse that process by getting oxygen delivered or getting that heart pumping again,
yep.
We've minimized the tragedy that can come out of this. And so, I think that there's a real strong message from us that, bystander CPR and getting parents to know CPR can really save lives. It can also, take something that could have been tragic with brain injury that's permanent, and have that child have a normal function. And so, we really want people to be educated on scene and take that responsibility.
Absolutely. And there's great life-saving courses for children that revolve around water safety, as well as babysitting courses. So we see children as young as 11 and 12 that are learning CPR and first aid, and that's fantastic. We see it in the field with mom or dad suffers an event, but it can go both ways too. If they have a sibling that they're watching or something like that, then they're there and can help as well.
Excellent. Really kind of gathering the community around the children and create that safety net, still having fun, but we're having safe fun.
Yep.
Yeah. Well, you know what? It's I really appreciate working together with you today on this, Dave. I think that there's a really strong message to be given to the community, and thankful to Hamilton Paramedic Services, and thankful to our media partners who are helping get the word out this summer. Really what we're talking about today is it's important to have fun this summer. It's getting hot, let's cool down, but let's make sure we're doing that in a safe way. And what we want to stress and really kind of emphasize is keep the kids from drowning in the first place, and learn some skills so if something tragic does happen, then we've got the skill set.
And thank you as well. It's always fantastic to work on these collaborative projects and continue to work on them and bring these messages to the communities that we're serving.
Excellent. Good work, Mike.
You too.